Hi everyone. Today I will be talking about the early signs of autism as well as in another video I will be addressing resources that are available for parents, but I might touch a little bit about that towards the end of this video. My name is Ino Acha. I am the co-founder of Restore ADN Speech Therapy located here in Texas. So really just kind of diving into that way I can keep this video pretty short. That way you guys can assimilate the information that is really needed and what I'm trying to pass on to you guys here. Really just an overview of the early signs of autism will be the main focus of this video. I think a lot of parents or a lot of individuals do struggle with that. I'm hoping this video can really help individuals out there to quickly identify the signs of autism. That way you can seek the help that's needed. Autism spectrum disorder, for the purpose of this video, I will refer to it more as ASD, does include a variety of symptoms, primarily if affecting the social skills of individuals, communication skills, as well as the behaviors. Why is it important? Early recognition and intervention are key aspects. Research have actually shown that children who receive support before the age of 3 often experience significant developmental improvements over time. For example, a child who receives early speech therapy for communication challenges may improve expressive language skills and build a foundation for social interaction. Early intervention for sensory sensitivities can also help a child become more comfortable in various environments, such as kind of transitioning smoothly between a home to daycare setting and vice versa. Talking about early signs of autism for infants, yes, you can actually detect signs of autism for infants between the age of 0 to 12 months. There is that social engagement. There are limited eye contacts. Infants typically make eye contact during feeding or playtime. If a baby frequently avoids eye contact, this might be an early sign for you to pay attention to. Also, the lack of social smiling. Most infants do respond to smiles around the age of 6 months old. Now, when there are limited responses, this may also indicate social challenges that should be looked into. In terms of communication, no babbling or cooing by 6 to 9 months. Now, babies typically babble by this age. A lack of it can suggest a delay in language development and a lack of response to their name between the ages of 6 to 9 months, also could be one note because many infants do respond when their name is called. Consistent lack of response can indicate a need for further assessment in these children. There are behavioral indicators as well. Children could show minimal interest in interactive games like peekaboo. This is very engaging for many infants. They might, show very limited interest in that. A baby who doesn't seem interested may be showing early signs of ASD. Now, a rigid focus on specific objects. Now, for instance, a baby is intensely focused on a spinning wheel of a toy car rather than exploring other aspects of the toy may have a repetitive focus, right? So those are signs to pay attention to. You do want to contact your pediatrician if there are any of the signs that are consistently observed. Now, the key word there is consistently observed. A pediatrician can conduct initial screening and refer to early intervention if needed. Of course, if you do notice this, please, just pay attention to that. Call their names during playtime and see if they respond. If the baby remains focused on a toy, even after repeated attempts, this might be worth mentioning to your pediatrician as well. Looking at early signs of autism between the ages of 12 to 24 months. Now, also, exploring the social engagement aspects of it, there will be lack of showing or sharing. Typically, toddlers like to share toys or show their favorite objects to their caregivers. There might be limited interest in social play, preferring solitary play even when other children are present, might indicate a need for support. Communication, no single words. The child have not, there are no single words by the age of 16 months. There are no 2 words phrases by 24 months. Most toddlers begin forming words and simple phrases by this age. Limited gestures. Toddlers usually point, wave, nod, or communicate. Lack of gestures can suggest delayed social communication as well. Behavior indicators to pay attention are repetitive movements. Actions like hand flapping or spinning can be a self-soothing behavior for some children. So you do want to pay attention to this. Resistance to change. A toddler may have meltdown if there is a change in their routine, like a new bedtime or mealtime schedule. This could be signs as well. So really, again, you do want to contact a developmental pediatrician. If these behaviors do persist, a specialist can actually provide a more detailed assessment. Early intervention services are available for children under the age of 3. Early intervention can help with speech, can also help with play skills and managing sensory needs as well. So a toddler, just for example, for clarity, a toddler has a meltdown whenever they're asked to leave a favorite activity or change a play location. This might be more than just typical behaviors and is worth mentioning it to the professionals. Early signs of autism for preschool children between the ages of 3 to 5 years old. Social engagements, their difficulties engaging in group play, prefers repetitive solo play. Now, the key word here is repetitive. Solo play, such as lining up toys instead of cooperative or pretend play with their peers. Trouble understanding emotions. Now, the child may not respond when another child is visibly upset or may seem unaware of other emotions. In terms of communications, delayed or unusual speech patterns, for instance, repeating phrases or using third-person references such as Tom wants milk instead of I want milk. So if a child constantly says Tom wants milk and they're referring to themselves, they should be saying I want milk, not referring to themselves in the third person. So communication skill to pay attention to. Again, limited use of eye contact in conversations. They may look away or focus on an object rather than the person they're speaking with. Behavior indicators to pay attention to as well are intense reaction to sensory inputs, sounds, textures. Bright lights may lead to strong reactions or meltdown. These are behavior indicators to pay attention to. Rigid routines, insisting on using the same color plate at every meal, for example, and just becoming upset if that plate is unavailable. Now, this does not mean it applies to every child, but if you do see a pattern, you want to pay attention to this as well. Of course, you do want to contact speech pathologists to do an assessment and intervene in speech and language delays, or also a child psychologist can evaluate social and communication skills through standardized testing. Just for clarity, for example, a child is consistently avoids playing with other kids and prefer organizing toys in a certain way, they may benefit from a professional assessment just to determine if intervention could help build that social skills. Early signs of autism for school-age children between the ages of 6 to 12 years old. When it comes to social engagements, they have difficulty making friends. They have trouble understanding social cues, can make forming friendship very challenging. Challenges with back and forth conversations, so struggles to keep a conversational flow, often switching topics abruptly or focusing on their interests. In terms of the communication, persistent restricted interest, the child may focus on a single topic like dinosaurs, talking about it even when others have actually moved on from that topic. Literal interpretation of language may misunderstand phrases like it's raining cats and dogs and take them literally. Of course, first instances, you can correct that, it's common, but within this age, you do want to see that they are beginning to understand what you have been previously interpreted to them as well. Behavior indicators to pay attention within this age range are inflexibility with routine changes. Now, changes in seating at school, for instance, may lead to like a heightened anxiety for children within this age range, or just trouble with imaginative play. They may prefer structured, rule-based games over imaginative play scenarios. Now, you do want to contact school psychologists. There are school psychologists that can work with the teachers to evaluate and potentially arrange accommodations like an IEP, which stands for an individualized education program. This is within your school district, so please contact them for the support. Also, there are behavioral health specialists. There are BCBAs out there that work within ABA clinics, or some schools do provide ABA therapists within their school setting. They can also help address specific behavioral challenges that impact learning and socialization. And that's one of the things here we do at Restore ABA and Speech Therapy as well. We do have board certified BCBAs that are able to really, conduct this assessment as well. Moving on to early signs of autism, just between the ages of 13 and 18 years old as well. Social engagement to pay attention to is really just that difficulty interpreting nonverbal cues. Teens with autism often struggle to read facial expressions, body language, or even the tone of voice, which are essential for understanding social interaction. They might miss cues that a friend is upset or excited, leading to misunderstanding or just an overall social disconnect as well. Limited close friendship. Many teenagers with autism prefer solitary activities over socializing with their peers. They may have acquaintances but struggle to form deeper close friendship. Now, they might join a school club because of a shared interest, but may have difficulty connecting with others on a more personal level. So, just the overall communications, they do have challenges with their social norms as well. So difficulty kind of understanding unwritten social rules, which can lead to an awkward or inappropriate behavior in social setting. Now, they might stand too close when speaking or miss cues to end a conversation, which can make others, kind of uncomfortable. But, of course, others do have to understand that we do have individuals with autism within our society and be able to accommodate these instances. Increased anxiety in social situations. Now, social interactions often trigger stress or avoidance due to uncertainty about expected behaviors or even fear of negative reactions from others. Now, just for example, a teenager may avoid social gatherings like parties or social dances and prefer familiar settings where they feel more in control. There are behavior indicators as well within this age group between the age of 13 to 18. Difficulty with life skills and organization. Many teens with autism do find it challenging to manage their tasks like time management, personal care, handling of money. Now, for example, they may need extra support with tasks such as planning, school assignments, organizing their workspace, or remembering daily routines like hygiene. They also do have rigid interests and hobbies. They often have a narrow focus on specific hobbies or interests which may not align with typical peer interests, making socializing much harder for them. Just for example, a teen may be intensely focused on a subject like gaming or historical events, often discussing it at length, even if others are not really interested. So again, who do you need to contact? You want to contact your school counselor or a transition specialist. The schools often provide support to help teens with autism kind of develop life skills, social skills, academic planning for life after high school. They can create an IEP, which is again the individualized education program, and transition plans to aid in this development. For example, a counselor might work with a teen to kind of set achievable goals, such as improving social interaction skills or even preparing for employment or college. Clinical psychologists or psychiatrists are there, for older teens. A psychologist or psychiatrist can actually assess for autism and addressing any co-occurring mental health concerns like anxiety or depression. A psychologist can actually help, with cognitive behavioral therapy. This also do help teenagers manage anxiety related to social situations and develop coping strategies for stress. So really just for further clarity, just interpreting social cues, a teen may not pick up on a friend's body language, indicating they're uncomfortable. Now, if a peer looks away or steps back, they may not even recognize these are signs to adjust their approach. So these are social cues that, teenagers with autism tend to overlook. Anxiety in group setting, a teen might find school assemblies is overwhelming due to the number of people and lack of structured social rules, leading them to kind of sit in the back away from others as well. So really, again, just for all ages, there are behavioral indicators, avoiding physical contact or just a very heightened sensitivity to touch, unusual body movements like toe walking, which might persist into adolescence, sensitivity to sensory inputs such as bright lights, loud sounds, which may cause discomfort or strong reactions. Communication challenges as well for all age group is really overall delayed limited conversation skills, even in familiar social settings, challenges with abstract language like sarcasm, jokes, idioms, which may lead to confusion or literal interpretation. So in our next videos, we're going to really talk more about the power of communication when it comes to individuals with autism. And we will be also releasing another video which will highlight overcoming nervousness and confidence building strategies for individuals with autism. And we will be also releasing another video which will talk about selecting visual aids. This is definitely very important for our individuals who are actually nonverbal. Again, thank you for watching this presentation. Again, my name is Eno Atcher. We are I am currently with the Restore ABA and Speech Therapy team, and we are here to support any individuals who feel like they need our help in understanding and also supporting with diagnosing autism as well.